Okay, hi everyone. Imogen and I are back for another chat, and this week we're going to be talking about strapping, taping, and also bracing, particularly for weightlifting and for general everyday functional movements and how that can benefit us. Welcome Imogen, first of all. Thanks for joining me as per usual. What I'm going to do is just introduce firstly some of the strapping and taping that we kind of use on a regular basis, both kind of that we do for our clients, to our clients as such, for those who need it, but also in terms of the things that we recommend in terms of advice and what the difference is between the tapes. And then Imogen's going to give us a little bit more info on kind of where we might use those, what are the most common ways to use them, and again, particularly why you might use them in certain areas. And then we'll talk a little bit more about bracing and just making sure that we don't overuse things like tapes too much, relying on them as such for what we are using them for, or, you know, thinking about what the root cause of the issue might be to try and address that, as well as using strapping and taping sometimes. Okay, so first of all, I'm going to run through some of the taping options that we've got out there. Now, one of the most common ones, probably I would suggest, is the perhaps therapist choice of tape, often known as tiger tape or K-tape. I've got a lovely blue one here. It can come in all different colours. This kind of taping can really help people recover from kind of like muscular and ligament injuries. It helps to ease tension and pain and discomfort, but also offers support, but with a decent amount of flexibility, which is good. So it will help you to, as I say, manage those injuries, particularly pulled muscles, also alleviate things like tendonitis, help with fasciitis, and also help reduce swelling if that is kind of particularly bad after an injury. We also have things like, it's also pretty popular, almost like maybe second choice kind of tape for therapists, tends to be zinc oxide tape, very similar to the K tape, provides really good kind of firm support. It is designed a bit more to restrict movement compared to the K tape, but it does give a really nice, strong and secure hold, which is good. And sometimes this is often used more when you are carrying an injury that needs a bit more protection. It's as I say, it's a bit more non-stretch, a bit more rigid. Great adhesion as well on this. It lasts pretty well in terms of length of time, not having to actually replace it too often. And also it can be used, let's say you play a sport that, you know, you get an injury, a small kind of wound on the field, something along those lines. Putting this over a wound can also help to prevent blisters, protects things like hands and fingers as well, depending on the type of sport that you do. So that can be helpful for that kind of thing. We also have something that's perhaps not used as much, but it is really good. It's called underwrap. So this underwrap, so it almost looks a bit like tights-like material, what tights are made out of. And this is really good to actually go under other tapes. It provides a bit of a barrier. It's nice and soft as well. And if you get easily irritated by adhesives in particular, this is quite good to put as a barrier before that. And it also reduces the risk of friction burns and things like that when you're using tapes. And then the last one that I tend to use a little bit more, and this might be this is more your heavyweight wrap, so it's an EAB wrap. You can get different versions of this, so this like a skin coloured one. It is very heavy duty, heavyweight and secure. You can also get these white ones you might recognise more. They've got this kind of reddish line through the centre, so you might see it on kind of like rugby players having strapped up around their knees. This is for tough conditions, so again, rugby players is an ideal kind of example of that. Often used around kind of thighs, so I say just above the knee area, head as well, and around the ears, so protection, particularly as I say for rugby players, that's really good. So this is more your heavy duty one, which might be used more either just before you go and play, or actually might be added throughout play again if you as a bit of a protection, particularly for things like ears. So there's all different tapes that we would use. As I said, we tend to most commonly use here in, obviously, you know, in our clinics and with our clients here on an everyday basis, tends to be more of the K tape, the tiger tape, and maybe some of the zinc oxide tape if they need something a bit more secure. But I'm going to hand over to Imogen to tell us kind of where she might use those tapes tapes in particular, what they are most commonly used for, and a little bit more about the benefits of using them, or thinking about when you do need them or don't need them.
Thank you. Yeah, so I generally, like you say, tend to use more of the more flexible tape. So I use Rock Tape, but it's basically the same as the Tiger Tape. It's just a different brand. And I generally will use it sort of I suppose there's sort of 3 of the sort of most common ways that you can use tape, and of those, 2 I certainly use more than the other. So the common most 2 reasons that I'd be using tape is either as a cueing kind of sort of stimulus. So if there's wanting to kind of either help kind of refocus a brain to kind of move in a certain way, or pay attention to a certain area, then I would use it like so for example, I would often use that sort of like the knee is quite a common area that I would use that round. So if someone's use the example of squatting, if people are squatting and the knees dropping in, then you might find that taping round sort of the lateral side of the knee is helpful, just as a cue to kind of, as you drop in, that you'll feel that tape stretch. So then it helps that sort of like physical sort of stimulus to be like, oh, actually I need to be able to move in this certain way. So I might use it in those types of sort of ways. Or the other more common one I use is either for like the decompressing or desensitizing. So it's almost kind of a bit of the opposite of the cueing, I suppose, is that having that sort of, the way I always explain it is a bit like when you put your socks on in the morning and at first you're aware of it, but because it's constant and it's not a threatening stimulus, eventually you start to just tune it out. It's not that that stimulus has ever disappeared, it's just your brain stopped paying attention to it. So the idea of the tape is from using it from that point of view is similar. It's that sort of constant stimulus over the area, but because it's not causing any sort of pain or any sort of threat, your body just stops paying attention to it, which by doing that can help aid sort of movements if they are particularly stiff or painful. So common areas for that one, a good example is with the back. If anyone's struggling with sort of the acute lower back pain, the taping in that respect can be quite helpful. Or I might use it in shoulders. A shoulders with when you get the shoulder sort of pain around. Well, I think we were talking about it the other week. So any sort of shoulder pain there that could be helpful for. Or sometimes I'll use it around sort of like talking about the tendinitis is Achilles tendinitis. It's quite a useful one, sort of taping around sort of the foot and the ankle. That's probably the one I use the most compared to between the 2, but it's very, very similar. Another area which I don't actually use it that often, mainly because I don't see it that often for it to need to be done, but one that I can use and stuff is using the same principle but for sort of through the neck to sort of help if you get headaches and things, because it's that decompression and desensitizing that works well. And then the other type of taping, which fortunately I don't actually use as often as you'd think, is more specifically related to, like you say, the swelling, which I always call it octopus taping, but it's technically called edema release. And the reason I call it octopus taping is because it's where you have your tentacles.
Yeah.
And then essentially the idea of that is that sort of tapping into the like lifting effect of the superficial tissue, which with that lifting effect and that stretch effect on that tissue should help sort of drain the drainage side of things, to reduce the swelling. So that's the kind of main reasons that I'd use the taping, and like I say, the main areas that I'd use the taping. And like you said, that's the taping that I use for. So if it's sort of with the stiffer tape and stuff like that, that'd be more from a sort of specific injury and where you're trying to actually like deload or reduce movement for recovery purposes, which is what I would use it for.
Yeah, and actually you brought up 2 things actually that made me think about what I wanted to kind of talk about at the end of this chat, which is how you can use tape outside of the clinic room, for example, so or outside of the gym room when you're doing training, so to make you think about your movement, which muscles you're using and how you should be moving. So it's almost like helping you with that process of what we call proprioception, so that mind muscle or that mind movement connection, which lots of people, particularly with particular muscle groups or even kind of muscles that support certain joints, so what we might call stabilizer muscles, and they find them very difficult to channel how they feel, when you know to use them and what to use them for and what joint movements they support. So again, coming back to your example of the squat, when people are coming in here and I'm teaching them about proprioception, about trying to kick on things like adductors and abductors on the inside and outside of your leg, and muscles like glute medius around the back there that go around the side of the hip as well, using those as stabilizer muscles for things like a squat or other squat like movements or even single leg movements, and improving both range of motion, joint health, and obviously growing muscle in those areas, to get them to understand how those muscles feel so that they can actually activate them when they're doing certain activities. We use things like bands, so the short little looped bands, we will put them over the top of the knees when we are doing a squat, get you to do body weight squat with that band around the top of the knees. And as soon as you start using that band and you've got the resistance there, and you think about tracking your knees out over your toes to make sure you've got good positioning, you will feel those muscles activate because of that extra resistance there. Now, obviously, when people leave my gym and they don't necessarily always have those bands, but then they've got to go and, they're going to go and do some training, whether it is actually kind of some weighted squats, or whether even like with runners and things as well, again, just kind of activating certain muscles rather than just always using your prime movers, overusing things like quads and hamstrings, actually making sure you're using glutes as well. Same for cyclists sometimes as well, and other sports that you might be doing, running down the football pitch, for example. You're not running around with a resistance band around your knees, and that's not going to be easy to do. Obviously, that's like a cueing tool that we use in here to help people understand how that muscle feels, what it should feel like when you're doing particular movements. But then using things like strapping, like some of the ones you've described, there again, as a bit of a mind kind of muscle or mind movement cue, you can obviously attach that essentially, to your body, and that can be there when you're going and doing those activities. So although, we discussed this before, we don't want to over rely on tools like strapping unless absolutely necessary. They're not a kind of fix, or we shouldn't have to do them for the rest of our lives just because we do this particular movement or this sport. But actually, as well as the things which I named at the beginning of, in terms of the benefit of providing support, and you talked about obviously about swelling and, recovery from injury, which is absolutely fine to use in the short term, just using it then as things like cues for particular movements, or feeling certain muscles activating and how they should feel, because obviously you get that tightness when you kind of either use the muscles or you're thinking about bracing when you're doing certain exercises. That can be a really useful tool, but again, it's reiterating not to kind of use those all the time, not to continue just using them. You've got to kind of build that mind muscle connection, and also recover. So don't always, we don't want to protect everything. It's a bit like putting a plaster on something. It's in the short term, it's fine, it's going to stop the bleeding, but actually long term we need to get oxygen to that, and we need it to kind of heal and recover. And that's the same thing. We don't want to keep kind of protecting injuries like 24/7. We've got to allow time for our body to adapt to having that not attached to our body the whole time, not supporting us the whole time. And so again, you might just use something like that. If you have had an injury, you're still recovering, and you just strap up just before you go and, play a football match, or, go out for a run or whatever it might be, but you're not necessarily keeping that strapping on the whole time, in your everyday when you're just walking around, or being at home, for example. So that's really important. And then the other thing that you kind of also reminded me of when we were talking about kind of, again, cues for our body, the one thing that we tend to use a little bit more in the weights room, which isn't always easy to do with the strapping. I mean, you can use some of this kind of, again, flexible strapping a little bit more on the back, but obviously if you're doing it yourself, that can be very tricky. So one alternative to get you to think about kind of bracing your core and using kind of muscles around your core in particular to help you with not only just general functional movements, but also, again, if you are someone who does go and lift weights, you do squats or deadlifts, that kind of thing, we might use a bracing belt. So again, you know, with bracing belts, if you're going super heavy and you're a real, like, you're into powerlifting, you'll see them wearing the belts. They need to, because it's extremely heavy weight. But for the majority of the people who aren't kind of going, you know, going that far, and they're doing just your general kind of gym work, you don't necessarily, again, you don't want to rely necessarily on that the whole time, but actually starting off, or on occasion, particularly when you maybe have increased your weights in what you're doing, you might want to use something like a bracing belt. So it's just a big thick belt that goes around. You tie it pretty tight, relatively tight, enough so you just got a little bit of space to get one or two fingers down the gap, and you will use that kind of as a bracing technique to understand what bracing is, how to do it. You breathe out into the belt, and then you're going to try and maintain that solid kind of, again, you build your core, build your abdominal muscles as well. Keep that there, but you're going to keep breathing through it to maintain your brace, as you might do a squat, for example, or possibly a deadlift. That's going to help you, keep that back nice and straight, not flexing out of position too much as you are then loading it, because our spine is not meant to move under extreme loads, apart from you've got a tiny little bit of flex, but you don't want it more than that. Something like a bracing belt is going to help you in that respect. Or literally, I just use it often sometimes here, not even when people are using weights, but actually just to learn about bracing in general. So no, bracing when we're doing other abdominal based workouts, core work, you know, even just planks, anything where you're going to have to, you know, lots of weightlifting and weight-based work, strength training involves you having to brace parts of your body, often through your core, particularly when you are doing isolation exercises. So for example, you know, you're just working on shoulders, or you're just working on glutes, for example, you might need to brace all other parts of your body, and something like a bracing belt can really help you to understand how to do that, what it should feel like, because that gap that I said, kind of, you leave that little gap in the belt, disappears, and then you kind of hold that braced position. Then you know what it feels like, you get a little bit of practice with it, and then after a while, once that becomes part of your habits and you understand how to use it to do different exercises, you no longer need that belt. So it's a little bit equivalent to how we talked about using strapping as a cue, and you can use that in the same way as well. So I think, although slightly different to what we've been talking about in terms of the taping, you know, you can use additional tools like that in a very similar way if you find it difficult to really get that mind muscle or mind movement connection with certain things as well. So yeah, I think that kind of, although we've kind of done a bit of a brief review of strapping and taping, I think it's kind of given some of our most, you know, top tips when to use, not to rely on it too much. I mean, is there anything else that you can think of that we've missed out today that is top tip? Again, with lots of these topics, we could talk for ages.
Thinking, I was like, oh, yeah, no, I like it. Mostly it's like you say, it's the top tip. I think if you are unsure of like becoming reliant on stuff like you say, it's thinking about it, if it's the graded exposure. So if there is bits like you say that is more newer, more intense, heavier loads and things like that, then yeah, you probably find using any of the tools that we've discussed helpful. Whereas if once you've kind of gotten a few sessions under your belt, you're a bit more familiar with the movement patterns and things like that involved, then that's when you can then test out without using them. Because there's the nice things with some of these is things that it's not a case of you can't that you once you've started you can't then add. So if you do start off and then you're like, actually this I am fatiguing, I'm starting to lose this sort of movement pattern, then there's things that you can reach to mid-workout if it's in a workout. And then, like I say, if you know that there are times when the session that you're doing that's not going to be as intense, or is not, or like you say, just day-to-day activity where you're not necessarily going to be needing that little extra, then they're the times when you sort of don't reach for the strapping and the tools and stuff that we talked about, so that you have that sort of essentially the graded exposure as essentially all I can think of. And
Yeah.
the only thing that I can think, the other bit of it is the same or similar with all, like when they talk about like your compression or the compression socks or sleeves,
Yeah.
and like your tubey grips and stuff, all of that type of thing will work very similar, because most of them are pretty flexible, not only certain straps and stuff, I would say, of the compression side of stuff are probably a bit more rigid, but
Yeah.
again, it will work, the principles will apply using those as well.
Yeah. And I think, like you say, it's just a case of just making sure, obviously, we said about not over relying on them for long periods of time. And if it is a case of, you know, that something like this gives you some form of release from, let's say, a pain that's developing, again, tendonitis, often type of feeling where it's overusage, it's okay, that's fine in the short term. It's providing you that immediate relief when you're about to go and do a strength training session, where you're about to go and play, you know, a match, whatever that might be. But actually, then thinking, okay, well, let's get to the root cause of this. Let's find out why this is happening. Why am I getting this elbow pain? Why am I getting this knee pain or this shoulder pain in the first place? I might be able to temporarily relieve it, you know, by putting on some strapping. But you know, where is this coming from? So again, when people come to me, it's more about, right, this is the pain that I'm getting, this is where I'm getting it, but what's that root cause? You know, let's look at the movement patterns, let's look at any imbalances, let's look at some, you know, any muscle weaknesses, previous injury history, of course, as well, and try and actually get to the root cause of it. So it really is just a short-term kind of fix, because it's not something you want to kind of continue doing for the rest of your life, and it's not going to be something that's going to fix the problem as such. And eventually, over time, you know, it's only going to probably increase and get worse. So strapping eventually, you know, isn't necessarily going to, you know, help in the long term. So yeah, it's just
But it's like you say, it's being clear and clear as to why you're doing it, isn't it? Understanding like what is it? Why are you using this? Like, what's your purpose for using it? Which will help give you that information, so that then you can see one of us or whoever to be like, this is what's happening, this is what I do, and this is why I'm doing it and what's giving me release. So it gives you a bit clearer picture of what might be going on.
Exactly, and it's always important with these, let's say, these short-term things, to try and get to the root cause of the issue, do a bit of investigating, and then you can kind of rebuild from there, so that this isn't something that you need in the long term. Okay, right, lovely quick whistle-stop tour of strapping, taping and bracing. I'm sure it's something we'll kind of come back to with some specifics again in the future. Reminder to people who do like watching our videos, if you do have any specific questions, any injury-related stuff that you want us to discuss, or maybe it's prehabilitation, so lots of prehab work as well, particularly if you're an athlete or sports person of any kind, do feel free to email us your questions. We're very happy to answer anything specific that someone has, do a bit of kind of weekly Q&A. You can contact us through our socials as well. Right, thanks for joining us again, Imogen. See you again next time. And take care, everyone. See you then. Thanks. Bye.
Bye.